Hey guys, Rebecca here. Thanks Karen for having me on tonight, and thanks for everyone who's watching along. It'll be my pleasure to help you guys out in regard to your blister situations at the Southern Lakes Ultra. So this is pre-recorded, I'm afraid, so I won't be on the call to take your questions as we go, but I'm sure if you've got some questions, just let Karen know and she'll find a way to get them to me, I'm sure. So let's just get straight into this. We're going to look at blisters in ultramarathon, obviously, and I'll be teaching you a few things, probably the most important things for you guys to know to get you through where blisters are a minimum of an issue, if at all. We're going to, better just shrink me a bit. We're going to broadly cover 4 topics. I'm going to show you some stats. We're going to talk about the most common blisters in ultramarathon, and then blister treatment and blister prevention. We'll look at blister kit contents because I believe you guys are taking care of your own blisters, which is great. So you've got some skills to gain if you feel like you haven't, if you're not on top of the blister situation just yet. And that means you need to not only have the skills but have the gear. And everyone wants to know about blister popping or blister lancing, so I'll walk you through that in case that's going to be a part of your blister treatment program. And in regard to blister prevention, we'll look at a few things. The 2 most common questions I get asked is about skin toughening and callouses, and how far we can go with that and how we actually achieve it, and tons of other strategies. And definitely we'll be looking at blister locations, and I'll be telling you how important it is to approach each blister on its merits, depending on where it is on your foot. So in case you've been living under a rock and you're unaware that blisters are a big problem in ultramarathon, we've got 5 pieces of research here that might make you think otherwise. This is the 2009 Western States Endurance Run and the Vermont 100. Blisters severe enough to affect race performance. So not just the incidence of blisters, but 40% of finishers said that their race was affected by blisters. That's a pretty big number. And 5.8 dropped out, or sorry, the 5.8% of them that dropped out said it was because of blisters. So there's definitely some, some attention needs to be given to blisters for sure. This one shows a pretty average blister incidence, 74%. This one, 100% of the participants studied, which was 90 of them, sustained blisters. No real surprise to me. And interestingly, 89% by the end of day 2. So we know that blisters are, if you can get past the first 2, maybe 3 days, you're more likely to be home free when it comes to blisters. So really not waiting till you get a blister, but implementing your best prevention right from the get-go is massively important and will stand you in good stead. Another one, Racing the Planet, 83% had blisters, again 80% by day 2. This one shows that every runner had an average of 2.2 blisters, so it's not just going to be one blister you get, likely. If you're lucky, it will be. But I've been to races where people have had 5, 6 blisters. And this also shows end of day 3, 72%. So if we can baby our feet through to day 1, day 2, day 3, we can almost, we're more likely to be home free in regard to blisters. So let's have a look at the 3 most common blisters. But before we do, I want to tell you something that's probably the most important thing that I can tell you right now. And that is, if you had a crystal ball and you are able to tell the exact blister location that you are going to sustain in this race, you'd have to say that that's a pretty handy thing, because you can get in and implement some great prevention knowing that it's almost 100% likely to happen. Well, the thing is that you do know this, and the most likely blister you'll get is the one you've had before. So if you've had a blister, say under your big toenail, that's the one you're probably going to get. or under the arch of your foot. So get in there, implement some prevention, take care of it right from the word go. Massively important. Other than that, I can tell you that from my experience, these are the 3 most common blisters that people sustain and that I end up treating. So we're going to have a look at some pictures of each of these. And yeah, I do apologise kind of in advance, but I don't apologise at the same time because it's really helpful to see some pictures, not only to see what they look like so you know what you're dealing with, but also to see how bad they can get, really. Let's have a look. Pinch blisters. So these happen on the little toes. Generally it's either the 4th or the 5th toe. This one's on the 4th toe, but they can happen on any toe. Really, once they form, they're really quite difficult to deal with, and then once the roof becomes torn, even more so, because there's only so much toe you've got to sort of play around with in regard to putting on dressings and implementing prevention. There's a couple of pinch blisters from Adelaide, I think. Here's a nasty one from Birdsville a few years ago on the 4th toe. That one's on the 5th toe, is a bit harder to see. You can see these lines here. You can see this line and then the blister, and you can see this line here. That's going to become a blister. We call these pinch callouses, and these are the toes that we know we're going to get pinch blisters on, because callouses and blisters are caused by the same forces. Callouses are the chronic presentation, blisters are the acute. So if you've already got these pinch callouses, it's kind of like where the toe comes to a point where it squares off or becomes triangular. It's because of the close apposition of the toes and how they kind of squeeze in against one another. If you see that you've got that, and especially if you haven't run an ultramarathon like this before, you can pretty much guarantee you'll get pinch blisters. So I'd be getting in there and finding a really good prevention strategy. There's a nice one on the little toe, and you can get them on the big toe or any of the toes. You can see this one on the big toe, but also the 3rd and 4th toes. They're pinch callouses that are just starting to become kind of macerated and starting to blister. Okay, so that's the first one. Let's have a look at heel edge blisters now. These are the blisters that tend to catch people unawares. People that, runners that run a lot, but maybe not the big distances. And everything's fine at the shorter distances, but when they get up into the big distances and start pushing themselves, these blisters kind of come out of the blue and just surprise them. So they're also blisters that can trick you, because you'll be thinking that this is where the blister is, that this is where the irritation or the blister causing forces are, but in fact it's happening right here. And it corresponds to the heel cup on your insole or your orthotic. So there's a lot of pressure here, there's a concentration of pressure here, and when the blister fills with fluid, it's kind of just getting pushed on all the time, and so that fluid follows the path of least resistance, so it kind of gets pushed to an area of less pressure or weight-bearing force, and typically they get pushed up higher, and you're starting to think, oh gee, I've got a one of these upper heel, back of the heel kind of blisters, but in fact they're an edge blister caused down here. So this is where you've got to implement your treatment and your prevention. Oops, sorry. Here's a couple from Adelaide, a bit hard to see there. This was from Birdsville. We've got a macerated edge blister that's actually a blood blister, so the arrow points to where the blister is being caused, and this is where the blister actually is. This skin is just macerated because this fellow had a band-aid on for a bit too long, and it was wet and soggy. We had a bit of rain on that race, and so the skin's kind of macerated. And I think this is the same fellow as well. He gets edge blisters on his heel quite often with these big races only, and that one's got a bit of blood in it. This one was from Adelaide the other year, 2019, I think, and we've got a blood blister here. This here is a big callus, and it's no surprise to me that this blister formed. Really, it was always going to happen. Remember, calluses and blisters are caused by the same forces. If you've got a callus there, and then all of a sudden you add in all this running, you know that the skin is going to have to cope, and it won't be able to cope, and it will just form a blister. That's kind of how it copes. So callus equals blister. So if you've got a callus, deal with the callus, but get rid of the forces that are causing the callus, because they're also the forces that will cause your blister. And in regard to heel edge blisters, it's all about the shape of the heel cup. And we'll talk about that because I'm going to go through prevention for these 3 common types of blisters. Rightio, we're getting up into some gnarly blisters now. This was someone on a Facebook competition for worst blister, I think. So again, cause down here. This is a blood blister, obviously. The fluid just tracks elsewhere where there's less pressure. I think that's the same blister. This was Adelaide. We've got some adjacent heel edge blisters. And this one is a nasty one. I don't remember where I got this photo from, but you can just imagine the heel cup of the orthotic or the insole. It's either bulky or there's something prominent about it. This is where the blister is being caused, and all this fluid is just getting pushed there because, you know, the heel cup ends here and there's less pressure here. So this is where all the fluid goes. This one was Canberra a few years ago. The blister's caused here. The blood from the blister, because this is a blood blister, tracks upwards. So I hope you're getting the picture. This one is nasty. This is a video on YouTube that I saw ages ago. And my gosh, like you can just see that's where the heel cup is, and it's just irritated. The skin's all bubbled up because of the blister fluid. Nasty. All right, so that's heel edge blisters. Let's get into ball of the foot blisters. Here's a good picture just to start off. Nice one. We've got a macerated torn blister under the central met heads there. This one came from a colleague who needed some advice. Now this blister is mechanical. You can tell that because we've got the callus here and the callus here. So I know that this is because this joint here doesn't work very well. Blisters under the ball of the foot, there's commonly a mechanical reason for them, as in a foot mechanical reason for them. So if you are getting blisters under the ball of the foot, a trip to the podiatrist is not a waste of time because we can usually figure out what's going on. Nice couple of ones there that I found on the internet. Here's some nice de-roofed blisters. Ouch. Here's a blister where it's actually being caused here, but the fluid, because this is a weight-bearing area of the foot, the fluid is being pushed to somewhere where there's less weight-bearing pressure, and it's down there. This one's a resolving one. This is obviously a week or so later. We got a pinch blister there, an old pinch blister. Same here, and we've had a big ball of foot blister here. The roof is all calloused and blah blah blah. There's a nice blood blister. Here's a callus. So this is a callus. If it hasn't already got a blister under it, it will. This is an edge blister of the forefoot, so we can get, as we've just talked about heel edge blisters, but you can also get edge blisters at the ball of the foot. When they're under a callus, they're really hard to deal with. But there's some really easy and effective things that you can do to prevent these blisters. This one I use just to show kind of the different colours that you can get blisters in. So this one's a blood blister, clearly, a bit less blood, so it's less dark. Normal blister, so it just looks like skin that's bubbled up. And this here is a callus, this kind of yellowy colour. Edge blisters of the forefoot. There's a nice edge blister. From someone local, I think that one was. This one's nasty, I do apologise. So we've got a D-roof blister under the 5th MPJ. That skin's very thick. It tells me that he's had a callus there for a long time. Callus equals blister once you start running big miles. So we would have known that that was going to happen, and therefore we can get in and we can implement some great prevention. This one was from MDS, a fellow called Christian. He sent me this. So he's lanced his blisters a couple of times under the ball of the foot here, and they just look a mess. I don't know whether it's infected or what's going on, but his whole feet look a mess. So they're the 3 most common blisters on the feet for ultramarathon that I find. and we'll get into looking at some prevention about them in a minute. But I've got a question, that is, how would you treat these blisters? If this was your feet, how would you go about treating any one of these blisters? So let's say we've got that one. So this is an intact blister. These are torn blisters because we've lanced them, and this one's de-roofed. So that's a bit of a clue there, because it all depends on the integrity of the blister roof. Again, we've got an intact blister, de-roofed blisters, and a torn blister. You would treat these blisters subtly differently, and the subtlety in the treatment is actually quite important. So let's get into blister treatment. Now I've got a video I want to show you that I made a while ago, and it goes through the treatment aims of the 3 types of blisters. So let's just get into that video, and we'll play that right now for you. Bear with me. When it comes to blister treatment, there are 3 types of blisters: intact, torn, and de-roofed, and they each need a different slant on treatment. So let's look at how we treat each of them. A blister will start off with his roof intact. How long it remains intact is subject to many variables, but on the bright side, the best thing about an intact blister roof, if there is a good thing about having a blister, is it can't get infected if it stays like this, because the roof is intact and that skin is keeping the blister fluid in and the germs out. So protecting the blister roof is our main concern right now, by putting an island dressing on it, maybe a band-aid or a cutiplast, anything where there's an absorbent non-stick pad surrounded by tape on all sides. The dressings on the right, they don't qualify as island dressings because dirt and germs can get in underneath. The good news is though, if you secure each of the open ends with another piece of tape, you've turned this into an island dressing that will block out the dirt and germs. Just make sure there's no tape on your blister roof. I mean, you don't want to rip the blister roof off when you take this off, so make sure there's nothing sticking to your blister roof. And don't forget, you need to reduce pressure, maybe with some cushioning or by using a special lacing technique to stop your toes from jamming into the toe box of your shoe, or maybe adding a felt donut pad. It all depends on where this blister is on your foot. And you've got to reduce friction levels, like with a lubricant or changing into some dry socks or adding an Engo blister patch, again all depending on whatever's going to work for this blister location. These things are going to stop the skin from stretching too much. And remember, the stretching in the skin is what caused the blister in the first place. We're trying to minimize that shear so your blister roof will remain intact and so your blister can start to heal, even though you have to keep standing and walking or running on it. All in all, the aim of treating this blister is to protect his roof. But what happens if you don't protect the blister roof? Well, it will tear, and that's when the alarm bells start ringing, because as soon as it tears, it's open to infection. So we need to do everything we did for the last blister, plus now we need to use an antiseptic to kill any germs lurking around. I prefer a liquid for this rather than a cream or an ointment, and betadine or povidone iodine is my favourite. And we need to monitor it closely for signs of infection. And a quick tip, ideally keep the torn blister roof in place because that skin provides some protection to the raw blister base. All in all, the aim of treating this blister is to prevent infection. Now, what happens if you don't do enough to protect a torn blister? The answer is his roof will rub right off and you'll be left with a red raw sore called a de-roof blister. A de-roof blister is more painful, it's more open to infection, and it takes longer to heal. So do all the things you did for the last blister, but now there's a focus on healing, because we need strong, flexible, resilient skin to grow back over that raw blister base, and we need it to happen fast. And that's what your dressing provides, a moist wound environment. You can use an island dressing for this blister, or there are lots of circumstances when a hydrocolloid dressing like Compeed is the dressing of choice for these blisters. Look, the most common mistake I see people make with de-roof blisters is letting the air get to it.
If you let a D-roof blister dry out, all that will happen is you'll get a scab over it, and a scab isn't healed skin. You've still got a raw blister base underneath that scab. The scab is inelastic, it irritates the blister base, which is trying its best to heal, and it's easily dislodged, leaving you back at square one with a D-roof blister. So keep a moist wound environment for the fastest possible healing. All in all, the aim of treating this blister is to get good skin healing.
Okie dokie, so that explains the aims of blister treatment. So I hope that helps clear things up a little bit. Now everyone wants to know, how do you pop a blister, or when should you pop a blister? And I would direct you to this blog post down here, this article that I wrote about when it's a good idea and when it's a bad idea. Essentially, it really depends on what you're doing, the environment that you're going to have your feet in, whether it's the end of the race or the start of the race, what your health situation is like, what materials you have with you, do you know how to use the gear that you've got, etc., etc. So I won't go through all of those things, but do have a read of that article because it's really quite handy. But what I want to show you is how to lance a blister properly, and in a way that it's not stressful. Like, people get a bit worked up about popping blisters in that it's a really bad thing, but it's not the worst thing in the world. And in fact, I think popping blisters is sometimes the best way to go. So let's have a squiz here. This one hasn't got sound, but this was in Adelaide, and we've got 2 heel edge blisters, and we're going to lance both of these. The biggest thing that I want you to take away from this video is the fact that lancing a blister is not painful. There's not pressure involved. You don't have to squeeze the blister fluid out and make things painful. It really is quite basic. The blister roof, the skin of the blister roof, is sitting quite proud. So we generally are only going to lance, quite big blisters, ones that are very full of fluid. So the skin is actually sitting quite proud, and it's not tender, it's not painful to cut that skin. It's all the epidermis. We're not getting into the dermis yet. So cutting that skin to allow the pressure, the fluid to escape is, well and good. And the best thing about lancing a blister is we know that if you've got a blister, like these especially, and you just put your shoe on and ignore the fact and just hope for the best, we know that in most situations they're just going to burst on their own. So it makes sense just to take the bull by the horns and do that process in a controlled environment, one that's clean, one that's not in any, there's not any risk of it getting infected. So you can see how easy it is just to lance that skin. And it might look like I'm pressing here, but I'm really not. It's just such minimal pressure. That's all you need is just encouraging the fluid to escape that little hole that you've just cut in the blister roof. You can see all the blister fluid that's come out and gathered on the bluey underneath the feet there. A bit of betadine. Remember, we've only lanced the skin in one spot, so it just really doesn't need an awful lot of betadine. And then after that, because we've got a torn blister, we'd put an island dressing on it. And that's basically all that blister popping is. I've got another one here of a pinch blister. That one's worth a look too, because in fact in ultramarathon we know that toe blisters are the most common, and with pinch blisters being the top of the bunch, this is a likely one that you'll be wondering whether you want to deal with it by lancing it. So that's one aspect of treating blisters. The other very important aspect is, especially for you guys, because you'll be doing all your blister treatment yourself, is to have a good blister kit, or to put some good blister kit components into your first aid kit. It's just massively important. Like, if you don't have the right gear, you've got no options. You can't really give the right treatment. It's just not an option. So there are things that you just need. In its most basic form, you need antiseptic. Antiseptic just kills germs so it doesn't get infected. You need island dressings, which is a fancy way of saying band-aids, and ideally of different sizes. and a blister lance. So that's a scalpel blade or a needle or whatever you decide you want to lance your blisters with. Ideally you use something sterile. Pocket knives, needles that are just kind of hanging around in your kit are not ideal. I mean, a lot of people get away with it, but they're getting away with it and it's not great practice. So it's not hard to get hypodermic needles or scalpel blade, so I highly recommend that. Going a few steps up from there, you'd have some hydrocolloid dressings. Compeed is the one you've probably heard of. Hydrocolloids have a bit of a bad rap, in ultramarathon especially, and I've been to races where they want to ban hydrocolloids, and I understand why, but hydrocolloids are fabulous. Like, they're just the best thing ever for D-roof blisters. The problem is when people don't just use them on D-roof blisters, they use them either as blister prevention or to treat an intact or torn blister. And all that's going to happen is when you tear that, when you go to remove the hydrocolloid, because there's been the loose damaged skin is stuck to the top of it, it's just going to peel that right off. In fact, what you need for a hydrocolloid dressing is you need a weepy blister base, and that's the bit that combines with the hydrocolloid particles and helps to speed up healing of that D-roof blister. And if you don't have that, then you're asking for trouble. So hydrocolloid dressings are great, perhaps towards the end, like the last 2 or 3 days, 1 or 2 days of the ultramarathon. With hydrocolloids, they work best when you leave them on for several days at a time. And in regard to doing them mid-ultra, I would be inclined to only use them if you have got a fabulous prevention strategy in place, because if you don't get rid of the blister causing forces, that blister will continue to develop and you'll be needing to replace that hydrocolloid, twice a day at least, which is just a waste, because we need the blister fluid to combine with the hydrocolloid particles and just to stay in place for 2, 3, 4 days. That's how it really, really works to speed up healing. In your average blister kit, I definitely have some tape, and tape works by spreading shear load. That's how it works in preventing blisters, and obviously it forms a bit of fixation. So if you put a dressing on and it's not sticking so well, let's say your feet are really sweaty or it's been raining, you want a bit of extra tape over the top of your dressings or padding or whatever you're putting on your foot. So tape has a double function. Pressure management, we generally have pressure management in the blister kit with a felt. So in my blister kits I have 5mm felt, and I would say that's a minimum. Moleskin just doesn't do enough. Moleskin is basically tape, so that's the stuff, like, I compare it with, all of the tapes. It's just a rigid cotton tape. It's not thick enough to provide any pressure management at all, even if you put 2 or 3 layers on top of one another. So pressure management is donut pads. Donut pads cut out of some 5mm felt, and maybe even some, in my ultra blister kit I've got some Poron or PPT, and we'll use that to absorb some shear and to provide a bit of cushioning. So yeah, it depends on how far you want to go. Friction management, of course, we need something to reduce friction levels. A lot of people would have a lubricant, which is fine. It has its downsides, but a lot of people get away with using a lubricant, and that's great. If you're not getting away with a lubricant though, don't be surprised. Get some Engo patches. Engo patches are fabulous. They stick on your shoe so that every time you put on your shoe it's just there. The downside to Engo patches is that if your shoe gets waterlogged, they may come unstuck, and you can't apply them to a wet shoe. It has to be applied to a dry surface. So if you know that you're going to get a blister, or you're pretty sure you're going to get a blister, I would go with Engo patches to take out friction levels, take the friction levels out of the equation. And if that doesn't work, I'd have my lubricant or something else up my sleeve. And shear absorption, that's your insoles, if they're nice and cushiony, will be giving you some shear absorption. Shear absorption just means that shear, or the stretching, happens within the material, so less of it has to happen within the skin. And if you know anything about what I teach about blisters, is that blisters are caused by shear. They're caused by the skin and the bone moving out of sync. So the bone, when we're walking and running, it sort of moves back and forth within the foot, and our skin is stuck to our sock and our shoe thanks to pressure and friction. So it's the bone moving back and forth and causing all the soft tissues and skin in between to stretch. So if we've got some materials that undergo some of that stretch, then there's less of it that needs to happen within the skin. And for toe blisters, have a look at gel toe protectors. They are fabulous. Fabulous in any situation, but can be a bit tricky in ultramarathon when our feet are swollen after, day 3 or something, particularly the continuous ultramarathons that I go to. They take up a fair bit of room around the toes, and the problem is shoes often don't have a lot of room to spare in the toe box. So I tend to use and suggest gel toe sleeves and caps early on. Get as much relief out of those as you can. And then if things get too tight in the toe box, then you have to just rely on your other friction management strategies to keep the blisters away. So I could show you my 3 blister kits, but I'll let you go and have a look at them on the web yourself. Sterile Blister Lance Pack is our bare bones little blister kit. It basically has those first 3 things, antiseptic eyelet dressings and a blister lance. It has 4 treatment episodes in each one, but it's pretty basic. It's got some cotton wool products as well. You need at least this, but really you need more. For a 6-day ultramarathon, gosh, you need more. The Advanced Blister Kit is great. It's got all the things with the ticks in this blister kit, but it doesn't have much of it. So for ultramarathon, and that's how and why I put together the Ultra Blister Kit, is because it has enough of the components to last you, a 6-day ultra, more than likely, knowing that most of the blisters we get are day 1 and day 2. So if you get a blister on day 1, you're going to have that for the other 5 days. So you need to have enough dressings, antiseptic, and all the rest of it to take care of that blister. And that's just assuming you have 1 blister. So check out those blister kits. Also, this article down here, I've done a review of 14 different blister kits that you can get from all over the place, UK, Amazon. There's some great ones out of the UK. So if you don't like the look of mine, or you think mine are too expensive, and you just want to, or even if you just want to see what's around, have a look at that article. There's videos of each blister kit if there's one available from the manufacturers, and it'll show you how to use it. I give it a few comments to say what I think of it, and we've got these ticks and crosses to say yes, it satisfies that, but no, it doesn't have that. So yeah, really, before you either get a blister kit together yourself or you buy one, I'd probably go and read that article and then make your decision from there. Here's an equation. I call it the blister treatment equation. Most people, when they treat blisters, are just looking to protect the injured skin. They're giving it some, putting a band-aid on it and protecting it from infection. And for most people, that's what blister treatment is. Really, that's blister first aid. And blister first aid is very important, but when you're running an ultramarathon for 6 days, you need more than that. You need to prevent that blister from getting worse, and even better would be you need to start the healing process even though you've got all that running to do. And I can tell you that that's quite possible, even for blisters on weight-bearing areas. So it's a massive part of the way I teach people about how to manage blisters is implementing blister prevention while you're treating it. And if really, when you think about it, if you just got the blister prevention in before you even started, you wouldn't even need blister treatment. But if worst comes to worst and you've got a blister, it's not just blister first aid. We need proper blister treatment, which includes all the things that we'd use preventively. So on that note, let's get into the massively important topic of blister prevention. This is my passion because it makes the most sense. And I kind of apologize for this slide, but I don't. I like to bring some sort of order and framework to the topic of blister prevention. And I've studied what causes blisters quite deeply. and we know that blisters are caused by shear. I know I haven't gone into that too much in this presentation, but if you flick through, even on my homepage on my website, there's a video there that will show you all the ins and outs about what causes blisters. Massively important because it's misunderstood, and that's at the very root of why blister management is done so poorly and we get such poor outcomes. So feel free to have a squiz on my website, but have a look at all these ways we can prevent blisters. It's massive. There's so many opportunities for blister prevention. So let's just have a quick look at the mechanisms at the top, the three at the top. To prevent blisters, we can reduce the number of shear repetitions. So that's the number of times the skin moves back and forth, which is the same as saying reduce the number of steps that you take. Well, for a runner, that's not really applicable, and certainly not during an event. So there's really nothing that we can do on that front. Next, let's look at the other end. So number 3 there, we can increase the skin's resilience to repetitive shear distortions. What that means is we can toughen our skin. Toughening our skin, it's an important thing to do. We're going to talk about this in a little bit of detail in a minute. But I can tell you that this can only go so far. And in someone that's just gearing up to run an ultramarathon, presumably you're a runner by lifestyle anyway, but not only that, you've trained for this event. And that basically means that the ability for us to toughen our skin is topped out. Like, you probably can't do anything more to toughen the skin to make it more resistant to blister formation. So to me, there's very little we can do there. More important for someone who's, getting off the couch and wants to go for a big run or a hike and, just get into things. That's really important to slowly wear your shoes in and gradually increase your distance. But for someone like you, probably not quite so important or applicable. The one in the middle is where it's at, basically. The one in the middle is the one that represents all of the blister prevention mechanisms and products and tips and techniques and methods that we use to prevent blisters. So these 5 factors, reducing friction levels, reducing pressure, etc., every strategy comes in under one of these umbrellas, and some of them work by more than one function. Lubricants, obviously, they just reduce friction levels and that's it. They make things more slippery. I'm just going to pick a few out because otherwise I could talk for about a week about all of these. We'll talk about powders, antiperspirants and astringents and even moisture wicking socks in a minute. Toe socks, a lot of you probably wear toe socks. Toe socks are a blister prevention mechanism by reducing both friction levels and reducing pressure, but only for the interdigital space, so only between the toes. They don't do anything more than a normal sock anywhere else on the foot. So just set your expectations for toe socks. They're only really a blister prevention mechanism, better than anything else, for the interdigital space. Skin drying we'll talk about in a second. Engo patches, definitely get some of them. Look on my website, read about how Engo patches work. They're the best thing to reduce friction levels in a long-term sense and also without taking up room in your shoe. That combination is so valuable, and that's why I love Engo patches. They're my go-to friction management strategy, even before lubricants, definitely before lubricants. Low friction tapes, do they even exist? You can read about taping on my blog, but most tapes probably don't reduce friction levels. When reducing friction levels is all about making things more slippery. It might sound a bit weird, but that's what friction levels, and as a blister prevention mechanism, that's how they work. Reducing pressure, let's have a look at that quickly. Cushioned insoles, definitely do that. Don't have a look at the insoles in your shoe. If they're flimsy and thin, get rid of them, put some new ones in. Maybe Spenco insoles. We know research has shown that is probably the best material at absorbing shear for under the ball of the foot. Donut pads, we generally use that for blister treatment, but in a pinch they can be used for blister prevention. Gel toe devices, love them. They also absorb shear. They absorb shear more than anything, and this is how they really work. So they are fabulous. They have their downsides too. You can't use gel toe protectors once you've already got a blister because the skin is weakened and the gel is occlusive, so the skin can't breathe. And in that way, any blister that's weepy, it's just going to macerate much quicker than it ordinarily would with a Band-Aid. So gel toe devices seriously are just for prevention. Don't use them if you've got a blister already. But before that, blister prevention, second to none for absorbing shear. What else? Shoe fit. I'm not going to go into shoe fit. It's kind of, I don't know if it's basic. It's basic to me, but if there's anything you want to know, just have a look. Just search for that on my website. What else can I talk about? Orthoses, they can reduce pressure. They also minimize bone movement. And minimizing bone movement, that's a critical part of blister formation, is the way the bones move. And if you're struggling to have any impact in blister prevention, please see a podiatrist to see if there's anything that we can do, because there is potentially a lot we can do to make the bones move less, and that will just immediately mean that it's harder to get blisters. What else? Lacing techniques. Also have a look at lacing techniques. I see a lot of runners in the 6 days ultras that I go to have very loose laces, probably because the tendon over the front of the ankle gets tender, and so the most obvious thing is to loosen the laces, but all that does is it means your foot can move forward. The toes end up in a smaller part of the toe box. Even if they don't hit the end, they're just in a narrower part of the toe box, and it's a recipe for disaster. So do have a look at some lacing techniques. Look, I'm going to leave that there. Rest assured, all of those topics are written about on my website, so definitely go and have a look on there. But two of the most common questions I get regarding blister prevention is, how do I toughen my skin and how do I keep my feet dry? So let's have a quick look at both of those. To toughen your skin against blisters, you need to subject your feet to the very forces that threaten to damage it. So that sounds like it's a bit tricky, but essentially it just means training. It means training in your shoes and socks that you're going to wear. It means training for the conditions, the distance, the elevation, the surface. Might be hard for, every race that you run in, but the more you can replicate your running conditions, the more you will toughen the skin. It will adapt to those forces. It thickens slightly. The cell turnover is faster as well, and does provide a protective mechanism. If you're still getting blisters in spite of doing all the right things as far as adaption is concerned, then you need to just move to one of these specific blister prevention strategies and finding the best one or combination of strategies to deal with that blister location. And it's quite easy to do, so don't lament. We can get around this, no problem. Callouses is a very common topic that gets brought up. Callouses are a form of adaption, so it's the skin's response to repetitive shear forces in the skin. And when it happens to a low degree, day after day, what happens is we get a callus. The skin thickens and it calluses, and I'm sure you've seen some real chunky, thick calluses. They're not protective of blisters. So the adaption that we're looking for, it's thickening of the skin, but it's thickening that's barely noticeable. It's not a big, chunky callus. Calluses act like an irritant, really. Your skin will just keep rubbing back and forth, or the bone will still keep moving within your foot, and those shear forces will form a blister underneath your callus. Remember, where you've got a callus is where you'll get a blister. So you've got to, that's a blister you're going to get. So deal with the callus, but don't just stop there. There's a reason why you're getting a callus there. So you've got to take away the friction, reduce the friction levels, take away the pressure, absorb some shear, all that. So it depends on where this callus is, but we can definitely deal with that. So that's quite easily done. And a lot of people ask me, what's the best product to put on your skin to toughen it? A lot of people use things like Acetylene Tanno, black tea, foot soaks, salt water, alcohol wipes, this kind of thing. They broadly come under the umbrella of astringents, and astringents dry the skin out. Now you would think that would be good, and it is good, because dry skin has a lower friction level, and that is good for blister prevention. But it probably doesn't really toughen the skin. Not that there's much research to demonstrate any of this, but it probably doesn't toughen the skin too much. And if it works via a drying mechanism, it doesn't last long. You've only got to run for 5 or 10 minutes, even on a cold day, before your feet get a bit sweaty and clammy, and all of a sudden whatever drying effect that astringent had on your skin has been negated. So again, these types of things that you can do to dry your skin out in an ultramarathon or even just any running situation, it doesn't last long. It's not that applicable. There's way better things that you can do to reduce friction levels than just drying your skin, because that's what these skin drying powders, antiperspirants, astringents, moisture wicking socks, regular sock changes, ventilated shoe uppers, other skin drying strategies. These are all friction reduction strategies. Dry skin means low friction, moist skin means high friction. And I've got to tell you that I kind of concede defeat on the moisture aspect of blister prevention or blister causation. You can't stop your feet from sweating. They're going to get sweat, they're going to be clammy, and that's just the way it is. Does that mean that you have to get blisters? No way, it certainly does not. There are better ways of managing friction levels, even if you've got the sweatiest feet. What we don't want to get though is we don't want to get waterlogged skin. That's what you might know as maceration or even trench foot. So when the foot, it's like when you go to the pool or you're in the bath too long, your skin starts to get wrinkly. Well, it's just that, like several times over. The skin just gets weak and it tears and it looks like a blister, but it's just waterlogged skin that's lost all of its resistance to shear strain and just tears. So we definitely want to not have waterlogged skin. So we want to aim for dry skin, but we want to aim for not waterlogged skin, okay? Now, in this ultramarathon that you're going to, apparently there's a few creek crossings, and apparently you'll be running through wet grasses quite a bit. So there's the potential for maceration, and even snow, I believe. So there's definitely the potential for maceration, so we've got to cover this topic. Moisture can come from the inside out, which is perspiration, so it comes from your foot, or it can come from the outside in, so that's environmental. Dew, snow, rain puddles, river crossings. It's likely that the effect of perspiration is not as damaging as environmental water. I've written about this I've written 3 quite comprehensive articles on maceration, so feel free to have a read of those if you'd like to know all the research, because there's a lot there. They're massive articles, and I talk about all the different preparations, so they're quite good to read. But I'm just going to really skim over this. In regard to perspiration, the research shows that antiperspirants don't work. It also shows that powders don't work, and I'm referring particularly to talc powders and cornstarch powders. There's limited one piece of research that showed that 2 Tom's Blister Shield powder reduced skin hydration, but didn't affect the rate of temperature change in the skin, which is thought to be predictive of blister formation. So it seemed to have a beneficial effect, but then it seemed to have no effect. So the jury's really out in regard to powders, but of all of them, I'd go with Blister Shield powder, 2 Tom's Blister Shield powder. It's not a powder that absorbs moisture. It's actually a powder that is, it really repels moisture. So it works a little bit differently to your talc and your cornstarch powders. Astringents, well, I've just said that we probably think that they don't really work. Moisture wicking socks. Now, if it was up to me, I would wear moisture wicking socks. There's no doubt about it. But the research doesn't really support them. Now, what I mean by that is, and this article down the bottom goes into all the research in more detail, but essentially there was research, 2 pieces of research, and done by the same authors, and the first one tested 2 socks. They were identical in construction. They were quite thick. They had this anatomical padding like Thorlo. I think Thorlo's made them. One of the socks was made from 100% acrylic and one was made from 100% cotton. And of these socks, blisters were found to be much, much worse with the cotton. Now, you've probably heard that cotton is a bad sock fibre to wear and should be avoided. So that seemed to be all well and good. And we thought, yep, well, cotton isn't moisture wicking, so it stands to reason. But 3 years later, they did the same research, but this time the sock construction was that it got rid of the padded thickness part of it. So they were thin socks. So it was a cotton sock and an acrylic sock, both very thin. And the surprising thing was there was no protective mechanism. There was no protection offered by the acrylic sock. So the cotton sock performed just as well as the acrylic and vice versa. So it puts into question the moisture wicking effect or the hydrophobic effect of the synthetic fibre. Is that the mechanism that prevented blisters in the first study, or was it the thickness of the sock? Because we didn't change the materials, we just changed the thickness of the sock. So potentially a thick sock provides a bit of cushioning, which is a pressure management strategy, and absorbs a bit of shear. So moisture wicking socks, I would say yes, but it's not supported by research, surprisingly. At the end of the day, at the end of the stage, definitely airing out your feet, your shoes and your insoles. Good idea, my word it is. And we're talking just about perspiration here. Dry socks, changing into a new pair of socks if they get wet, absolutely. Right, let's get on to this environmental moisture, because this is the one that you're going to have when you're running through the dew-laden grass and crossing your rivers. You can use waterproof socks. There is such a thing. They are completely waterproof. You fill one up, it's like a water balloon. There's no water that comes out of them. They're kind of like two sock layers with kind of like a plastic bag in between them. That's what it sounds like anyway when you're sort of mucking around with them. Dex shell is an example. Now I would say if you suffer quite easily with maceration and you know your feet are going to be wet for extended periods, I would try some Dex shell or any waterproof sock for sure. But knowing that your feet are probably going to get a bit wet in this race, I don't think that is a reason to all of a sudden change the socks that you wear. Don't pull a new pair of Dex shell out on the day and wear them without having trialed them, because they are quite a different sort of a sock. So you need to get used to them if you think that that's a strategy that you're going to use moving forward. And being a waterproof sock, remember, it's great because water can't get in, but also perspiration can't get out. So just remember that. If you've got really sweaty feet, because some of us have got sweatier feet than others, you can even get maceration just by the fact that your sock, there's nothing that can escape your sock. Waterproof footwear. Sounds good. Really the same reasoning as above. Yes, if you know your feet are just constantly going to be wet, do what you can to get waterproof footwear. But what is waterproof footwear? Really, water can get in through the eyelets where the laces go, and it can get in at the top of the shoe. So yes, you can get water resistant footwear, and that's definitely worth looking at. But when it comes to shoes, there are usually more important reasons for choosing the shoe that you choose. Sometimes it's hard to find a good running shoe, one that suits you. So I wouldn't all of a sudden be changing that and limiting your range that you can choose from just because you want a waterproof shoe. So think carefully about that one. Gaiters. Gaiters are something I would definitely be looking at because they can keep the water out. Just how with shoes, the water can get through the eyelets and it can get through the top of the sock. If you wear a good gaiter, it can prevent that. Ones like this one. See how this is kind of like a raincoat material, it looks, and it's velcroed all around the side of the shoe, right, all around. This one's also velcroed. I don't know how waterproof or water resistant that material is, and these are more for keeping the sand out in the desert. There's a bit of breathability to these because it's not really stuck to your foot, so the material is going to be moving and encouraging airflow, so it's going to allow moisture to escape. It would really depend on how water resistant the material is. But getting this Velcro, see this one down the bottom here, this black, this is Velcro that is sewn or glued onto the shoe. Look, I'm not a full bottle on gaiters, but I believe that most people go to a bootmaker or somewhere where they've got all the right materials to make sure that that Velcro is put on really in a sturdy fashion, because the last thing you need is for it to peel off. So definitely consider gaiters. Don't tip water over your head. It's tempting if you're really hot, but it's just going to run down your legs, into your socks and into your shoes, so it's not a good idea. Yes, air your feet, your shoes and your insoles at the end of the stage. If you've got them waterlogged and they're really wet, take the insoles out. Don't just leave the insoles in your shoe, because there's very little drying that can happen. Take them out, wring them out. If you've got some paper towel or a towel or something, you could even, do your best to kind of get some absorption from that to get the moisture out of your insole. Definitely changing into dry socks is a good idea, obviously. And a lot of people use this barrier creams, particularly Desitin, which is a 40% zinc oxide. I'm not the world's expert on this, but it's worth looking into. I go into this in one of those maceration posts. So perhaps have a look at that and come to your own decisions. Talk to some people that have used it themselves. It will, to a degree, it will work like a lubricant. It's going to retard the way things stick to your skin. So if you need to use a dressing or tape, it's going to be a bit of a problem. Yeah, I don't know. Consider it. Okay, so let's get back into blister prevention. This slide's quite important. Most people don't think of this, but blisters can occur on lots of different parts of the foot. This is just 15 of them, the most common ones. And their cause is all slightly different. So what causes blister number 1 is not going to be the same as what causes blister number 2 on the outside of the little toe. And it's not going to be the same as what causes the blister under the arch or at the back of the heel. Now that might sound obvious, but how many of us implement blister prevention or different blister preventions with this in mind? Generally, if we implement a blister prevention, let's say it's lubricant, we'll lubricate all these parts that we think we're going to get a blister, or we'll tape all of these parts that we think we're going to get a blister. So we don't really think deeply about the anatomical position and the functional and structural causes of that blister. And this is how I get success in regard to blister treatment and prevention. Massively important. So on my blog, I've written about all of these blister locations, gone into quite some detail, and we're going to have a look at those 3 blisters that we've talked about, the 3 most common, and we're going to have a look at the prevention strategies that I recommend for each one. So let's get stuck into that. Pinch blisters. These are the strategies I would use. Taping, lubricants, toe socks, lots of people use these. Excellent, no problem with that. However, if it's not working, you've got to move up. You've got to do something different, otherwise you'll just keep getting the same results. These first 3 have limited impact. They have an important amount of impact, and for a lot of people that's all they need. But for some people, they need more, and you can get more. So don't think, I've done all this that I can do, I'm just going to get blisters, there's nothing I can do about it. First of all, try some gel toe caps. Again, consider the pros and cons, but there's definitely massive advantages to using gel toe sleeves and caps to absorb shear. If that doesn't work, go and see a podiatrist and get some custom made wedges made out of Ottoform K. It's a material that we use to affect an even pressure and in between the toes, and to hold toes in a certain way so that there's not a concentration of pressure. And then there's this really advanced strategy which I've talked about in quite some detail. It works a treat. Great for race occasions where it's really important that you keep going. It's really important that you don't pull out. You need some pain relief, but you've got to keep running. It's really, really cool. So this is some pictures. Taping. I'm going to show you how to do taping in this next web page that we look at. Lubricants, this is like Vaseline on the foot. Toe socks, Ottoform K toe wedge, that's just one example. Gel toe caps, really, really good. And this is that advanced strategy, Engo patches on toe socks. These patches aren't going to last like normally they would, because you're going to have to wash this sock, and as soon as you wash the sock, the patches are going to come off. But let's just scoot over and have a look at this page. We've talked about this. Pinch blisters, what do they look like? We've had a look at most of those. This is that video that you should have a look at. That's me lancing a blister in Adelaide, a pinch blister. These are the things that are our blister prevention strategies. So taping. Have a look at this video and I'll show you how I tape toes. It involves 2 bits of fixable tape. You can use that strategy, but at least, you know, learn about it. If you've got a better one, absolutely do whatever works for you. What else have we got? Lubricants. In this video, see, we've got some Silic 15, we've got some Blister Blaster or something, Tri-Slide, which I like, Bag Balm, what's that, Udder Balm, the Band-Aid lubricant, Gurney Goo. Here's the Desitin, so you can have a look at that. Gold, Bond Gold. So there's a few, mainly lubricants actually in this video, and we've got some of these powders as well. Have a good look at that video too if you want to see more about the topical applications. Toe socks. I go into a very short video about how toe socks work, and essentially that is adding a padding component between the toes. This is those wedges that we make. So they can come in all sorts of shapes and sizes. It really depends on your feet and what the problem is. The gel toe caps, really, really cool. And this is the Engo on the toe sock. Really good for keeping the toes apart without having to add too much bulk. And the friction relief is second to none. So definitely worth a try. So that's pinch blisters. Do go and have a look at that page. Okay, let's get into heel edge blisters. So heel edge blisters are caused by a concentration of pressure and a friction, kind of a mismatch at the meeting of 2 materials or 2 parts of your shoe. That is the side of the shoe and the insole, so the vertical surface and the horizontal surface. So what we're looking to do is to make sure there's no concentration of pressure there. Heel edge blisters, we've seen that picture. Here are a few more pictures. These are the ones we lanced on that video. Right, 2 things. We need to reduce any thickness around here if that thickness is the issue. So as a podiatrist, I often get my drill out, reduce the thickness from the inside, or even reduce the thickness from the outside on a grinder. That's with an orthotic. We can do that on insoles, some insoles as well. And making a low friction junction. Now I just want to show you one more thing that's kind of in relation to this. Sometimes when you wear an orthotic, the whole orthotic slides forward, and this makes an indent in the shoe that is too far forward, and then whenever you go to put that shoe on, the orthotic is sitting too far forward. So here's an example. So this is the resting spot for this orthotic, and you can see there's this gap here. So the heel that sits in this shoe is sitting on the heel cup of the orthotic, right? And you can see the gap there. So if this sounds familiar to you, what you need to do is get some double-sided tape, put it under the heel cup here underneath, and pull it right back, pull the orthotic right back in the shoe and make it stay there. Otherwise, if you just place it back, all that's going to happen is as soon as you get your foot in your shoe, it's just going to slide forward again. Right, getting back to heel edge blisters and this 2-patch technique. So these are our Engo patches. What we're trying to do is, this way we're reducing pressure, and in this one we're reducing friction levels. So we want an Engo patch. Now we could use one Engo patch to cover the whole surface. That's fine. But what happens is, if your insole is cushioned, it's going to compress with each step that you take, and it's kind of going to drag this part of the patch If this is all one patch, it's going to drag it down and it's not going to last very long. And similarly, if you need to take your insoles out to wash them or get them dry, if you've just got the one patch here, you're going to have to get rid of that patch because it won't work anymore. So it's sometimes a good idea to pop one patch on the shoe or the insole part and one on the shoe. Now, have I got a video of this? Yeah, let's just have a look at this video. Edge blisters, again with an orthotic, but the same holds true if you've just got your normal insole in there. It's easy enough if the edge blister is at the side of the heel. You can apply a large oval here widthways to get maximum protection. Creases are fine on the outside, just not where your foot sits, and I've skipped the second patch on the shoe just for the sake of brevity. However, things change when a heel edge blister is around the back. Look at what happens when I attempt to apply a large oval to cover the whole heel cup at the back. It's impossible to get that patch on without leaving substantial crinkles in the patch that will only serve to irritate the skin. This difficulty is due to the curvature of the heel cup from top to bottom and from side to side. These creases are exactly what we're trying to avoid because they will irritate your foot, obviously. We need a smaller patch to avoid these creases. I usually use a small oval patch for this area, but you can also cut a large oval in half, place the rounded edge down and the straight edge folds over the back of the orthotic to hold it in place. This half large oval provides pretty much the same coverage as a small oval patch. If you need to cover a wider area, you can apply another patch and have them overlap a little. The patches are very thin and this won't be a problem. Let's not forget the second patch this time, the one that needs to go on the shoe. I'm using a large oval placed sideways for maximum coverage. Large ovals back here are easy to apply, much easier than on the heel cups of insoles and orthotics. You could use a small oval if you prefer, because really you're only protected for that area where the two patches line up. Just make sure your blister area is right in the middle of the patch so you're still covered if your foot moves a bit in the shoe, especially if you're on uneven terrain or you play a sport with lots of side-to-side movements. And make sure that patch covers a slightly larger area than the blister itself. Okay, so that's the two patch technique for edge blisters at the heel. And finally, ball of foot blisters. So these are the preventions that we use. Taping, everyone, well not everyone, but a lot of people use taping. Again, if it doesn't work, don't be surprised, just move on to something else. Cushioned insoles. We should all have cushioned insoles. They shouldn't be flat and flimsy. We want a nice cushy insole to absorb a bit of shear. Engo patches, for sure, a fabulous way to reduce friction levels that on your insole, so it just sticks to the insole obviously, and it's just there in and out. If it gets, you know how I said if the shoe gets waterlogged, the Engo patches might come unstuck. The ones that are underneath the foot are less likely to come unstuck. It's more the ones that are applied to the edge of the shoe around the toe box, because generally that material is, perforated, and so water can easily get in right to where the adhesive is. So it's less likely to happen on the insole. Biomechanical improvements, massively important for probably the majority of blisters under the ball of the foot. And donut pads, we often use these as treatment, and in a pinch we'll use them as prevention. So let's head over to my website again. Okie doke. There's our blister under the ball of the foot picture. You've seen that one. Why do we get them? Let's talk a little bit about anatomy and biomechanics. They're massively important. Biomechanics and anatomy is really important for this blister location. So taping techniques. Where's my video for that? Oh, here we go. I've got a couple of videos about taping.
That crease there could become a problem, but my second...
This video shows 3 ways to tape the ball of the foot, and I've got another one that's a bit shorter. This is a great video to watch, so definitely go over to this web page and have a look if you want to. If you haven't tried taping. Cushioned insoles, there's some Spenco. It's good for absorbing shear. The Engo blister patches, these are the large ovals, all depends on where you get your blister. You can also use the rectangle patch. There's the rectangle patches. Biomechanical improvements. One thing is calf stretches. I would always recommend that runners in a multi-day ultramarathon and even hiking, stretch their calf muscles at the end of the day, or as much as you can. When the calf is tight, it increases pressure under the ball of the foot. And to be honest, it just doesn't, it means that the feet can't work very well when our calf is very tight. So calf stretches are just great for feet in general, but they're fabulous for blisters under the ball of the foot. Now, if you've got a blister, doing a calf stretch is probably not going to do much. It's something that you need to do beforehand. So before your race, in your training, really make sure your calf flexibility is good. And then do it during the day, during the race, just to ensure that things aren't getting tighter. But don't leave it until you've actually got a blister, because the horse is bolted already. A few things about technique and donut pads. So this is a felt donut pad out of that felt that I have in my blister kits, or you can just buy the felt on my website. Yeah, what can I say? I could talk all day, but let's not. Let's end things up because I know that I've already gone overboard. So we've covered, we've had a look at some blister statistics, and we know now that blisters are a big thing in ultramarathon. We've had a look at the 3 most common blisters. We've had a look at some topics around blister treatment and also blister prevention. But if you remember just one thing from this presentation, remember that the most likely blister that you'll get is the one you've had before. So before you even get to the race, have the best prevention strategy that you can muster for that blister location in place, or the 2 or the 3 blisters that you know that you're going to get because you've had them before. Otherwise, to me, you're just not trying. You're just not even trying to get on top of your blister situation. These are the ones that are most likely to happen. We kind of know they're going to happen, so prevent them. It's not guesswork. It's the low-hanging fruit, basically, in regard to blister management. Tons of other things I could have talked about. It's all on my website. Head over there, have a good read. Let me go back over here. This is the blog, so there are categories. If you want to know anything about any of that, just click it and all those articles will come up. Or if there's anything here that is interesting, if you want to know more about blister kits, or you want to read some case studies, or you want to learn about Engo patches or gel toe protectors, or how to manage pressure, or how to use orthotics and what to do, lancing, maceration, that's where those 3 blog posts are. That's really good to read. Blister healing, how long it takes. We've got blood blisters, so look at that one. You know, it's all there. So I really hope that that's helped. If you've got questions, I'm sure Karen can get them to me, and I'll be more than happy to answer those questions and get back to you, perhaps on the Facebook page or something, I don't know. And yeah, let me know. Thanks a lot.